All right, we're good. Thank you.
All right. Good afternoon, everyone. I hope you all are well. I am Dr. Ericka Horne, and this afternoon we're going to be talking about community engagement. So, this is a two-part workshop around community engagement. This first session is called Bridging Scholarship and Community, Integrating Engagement into Research. Just a little bit about myself. I have a Doctor of Public Health from Florida A&M University. A lot of my research and my work has been around behavioral science and health education. I also have a certificate in epidemiology, but my work, day-to-day work, is rooted in community engagement, community organizing, and ensuring that the community is a part of the research. I currently work within the College of Medicine in the Department of Family Medicine and Rural Health, and I'm the Community Engagement Research Administrator. So I work alongside our physicians, I work alongside our community members, and help steer and lead that whole work that we're doing here within the college. So I'm really excited to be here today and to share about community engagement and how you are able to bring that into your work as well. We are going to have a somewhat interactive time today. So you don't necessarily have to come off camera or come off mute, but I will ask you to put some things in the chat every now and then so we can see what everyone's thinking. So we're going to start off with a quick icebreaker. So in the chat, if you would for me, please share what area of research you're involved in or interested in, and then 1 to 2 words that comes to mind when you think of community engagement. I'll give you a few minutes to think about that. And so I know you guys are typing in the chat. I'll go ahead and I'll share mine and then I'll read a few of them off. But for me, a lot of my work is around adverse childhood experiences, mental health and trauma, and the relationship to chronic illnesses and diseases. And when I think about community engagement, I think about the community voices being heard. So yeah, we see research development and thinking about community engagement, partnership, and collaboration. Absolutely. Stroke and dementia language disorders. I love that. I'd love to hear more about that. With Jonathan, HIV and sexual health. I'm Dr. Rudwani, a medical sociologist, but for all intents and purposes, implementation scientist with expertise in interventional pragmatic clinical trials. Love that. Pain management research at the con. Awesome. So, urban and regional planning. Yes, I love that with the rural focus. Community engagement needs, values, interests, quality of life, happiness, and well-being. Thank you for that, Jonathan. Ensuring that all voices are heard at the table and that we listen to those who have lived experience. So everything you guys are saying is very important and definitely a part of community engagement. What I wanted us to do with this is to realize that even though we can be in different areas of practice or study or interest or research, whether it is nutrition or rural health focus or stroke or dementia or trauma, when we talk about community engagement, there are some things that are key to the principles and to the concept of community engagement. So regardless of what area you're interested in, a lot of these similar practices will still be able to be used regardless of what field we're in. So we're going to go on, and I'm going to start with a quick overview of what we're going to be going through today. I see a few more in the chat. So Claudia said, hearing what's most important to the people we're focused on and we're designing programs for, that's really good. Health sciences librarian, love that. Interested in consumer health information and health literacy. And what are the needs in that area? Yes. Center for Leadership and Service, interested in research surrounding nonprofit management and leadership development. Community engagement is rooted in mutually beneficial relationships between organizations and people. All great responses. So for today, we're gonna go through what our objectives are. We're gonna go through the foundations of community engagement and then the principles of community engagement and talk about how they slightly differ. Then we're gonna go through a few models of engagement and then some practical tools to building partnerships and how we can share and sustain engagement past the grant cycle, past maybe if funding is up. And then we're going to have a few tools for developing a community engagement plan. So if you don't have one, hopefully these tools will be helpful for you. And then we'll leave some time for Q&A should there be any. And if at any time you have a question, feel free to raise your hand or type it in the chat and we'll get to them. So what are our objectives for the day? We wouldn't be here if it wasn't for objectives. We're going to understand the principles and values of community engagement. We're going to explore models and examples of integrating community engagement into research. We're going to identify potential community partners and engagement strategies, and also begin developing a plan to incorporate engagement into your own research projects. So we'll start with the foundations of community engagement. So community engagement is drawn from sociology, political science, epidemiology, cultural anthropology, organizational development, psychology, social work, and other disciplines. All in all, community engagement is not just focused on one discipline. It comes from multiple disciplines because the community is still the voice and the forefront of what leads in community engagement. So you see community engagement in lots of different areas. It has an interdisciplinary background which grounds community engagement in values such as social justice, collective impact and trustworthiness, fairness, and in listening. So listening is a key point of community engagement, as many of you guys stated when I asked you what is important for community engagement. And importantly, community engagement is essential for developing partnerships. There's no way you can truly have a sustained partnership, a long-lasting partnership built on trust and relationships if you don't have true community engagement. And so we're going to talk about the principles of community engagement. So before we talk about the principles, we're going to talk about what got us to this place of where we are today in community engagement and why is it so important. So we start talking about traditional research. And most times when you hear about research, the most respected times back in the day when it first came out, there was always a top-down approach to research. So in the academic institution, in the universities, they were the experts. The ones doing the research are known as the experts. It comes from the university and then it's spread out to the community. So the university, the researcher would do the work, then they would disseminate their results, and then they'll share it out. Most of the times, research was known to advance knowledge. If you wanted to learn more about a particular topic or area, to advance theory, to create new theories, to explain why things are happening, or within your specific disciplines, whether it is sociology, whether it is health sciences, whether it is nutrition, whether it is maternal child health. So there were specific focuses for traditional research. And it was from the university to public applications. So, university researchers were the ones that did the research, and then it was said to be shared with the public. This is how you approach a topic. This is how you approach something. So that's how traditional research looks. Now, when it comes to traditional research, we always talk about how do you measure your scholarly activity, right? It's through your outputs, it's through your journal articles, the books, book chapters, conference presentations, papers. It's having all of these different scholarly levels, and that's what traditional research looks like. But when we talk about community engaged scholarship, that's where we kind of see the shift from the expert being the researcher in the university to there being shared power, shared decision making, and shared consequences. So now everything doesn't fall just on the university researcher. It's not only their decision to make about what gets done when we look at research. And the researcher from the academic institution is not the main expert. The community is the expert. Someone mentioned in the chat about lived experiences and having those voices be heard and centered. And that's what we're talking about. For too long, for many years, there are a lot of researchers. We would say we want to do a research on a particular topic. And then we go into the community based off of the data that's available, tell them what's wrong, and tell them this is what they need to do to fix it, but not realizing or neglecting the fact that the community themselves also had issues that needed to be addressed. So for example, let's say you saw that there was data that showed that in Gadsden County, obesity is on the rise for adolescent youth. And so from the data that you see, you decide to come up with a plan, an intervention. You want to go into the community and say, we need to create this program for the youth to be a part of. But then when you realize, when you get to Gadsden County, this plan can never follow through. No one wants to buy into this plan. Because when you sit down and talk to the community members and say, what's going on? Why isn't anyone doing this plan? This is supposed to help you guys so that we can decrease obesity. It's so serious. They will tell you that we don't have safe playgrounds. We don't have safe sidewalks. We don't have sidewalks. We don't have lights at night. We don't have things that make it safe for children to go outside and play. And so unless these other issues are addressed, then we can't really address the issue of obesity. But with the community being the expert, instead of going in, even though we know the data may show something, we allow the community to tell us what they think the issues are. And they may say there's something wrong with the water. But if you work with the community, and you're addressing the community needs and their issues, then at the same time, then you will be able to address the things that are important from what the data may be showing as well. So this is what we talk about when we're saying it's sharing power, shared decision making, not just what the researcher wants to do. It's sharing resources. It's learning from others. It's being humble as the researcher to say, you know what, I may not know all of the things. I know this is important. We understand the data is important, but if we cannot get buy-in from the community, then we cannot move anything forward. And it's taking a collaborative approach to it. It's having accountability. It's knowing that together we are solving a problem, not just the university or the researcher coming in to solve a problem. And so when you look at the outputs, you still will have some of the traditional outputs, such as going to conferences, going and writing books and book chapters and presenting this information. But you're also going to find some additional outputs that you might see when you have a community engaged approach. You might see policy briefs. You might have workshops for the community to be involved with so they can learn some of the things. You might even do something different, have performances, have something visual for them to engage in, or trainings for things that might be helpful for them to move the project along. So when we first look at the principles of community engagement, we have to see where it stems from. And so understanding that this community engaged approach came after years of the traditional research and realizing that there had to be some additional shifting, we recognize where we're moving. And so we're going to talk about the 10 principles of community engagement. And so this third edition actually just came out last January, 2025, and it has increased. I don't know if anyone's familiar with the principles of engagement. It used to be 9. Last year, another one was added. Some of the work that we were a part of, even through our work with the CTSA, has been included in some of this, but it has increased to 10. And so we're going to go through what those 10 principles of community engagement are as per the CDC. So 1, we have to be clear about the goals and purposes of the engagement effort and the populations or the communities that you want to engage. So if you know that you want to engage adolescent youth, for example, you want to make sure that's clear and understood. Who is the audience that you want engaged? Who's the population? If it's for adolescent youth, you may not want to go to the senior center. You may not want to go somewhere else. So just be clear about who the engagement is for. That's the first principle. The second one is becoming knowledgeable about the community, their culture, their economic conditions, their social networks, who's in power, what kind of social organizations are there, their political and power structures that exist, the different norms and values that they have. What do they believe? What is understood? What does everybody in the community know? What are the different demographic trends? Who are most likely to do XYZ? What is the age group of those in the community? Who's working? Who's not working? What's the minimum income looking like? What food is available to the community? What food is not available to the community? Look at the trends. What are the death rates? What are the birth rates? What is the history of the community that you're trying to work with? You have to understand that. You have to understand even the experiences and the efforts that are made by outside groups. So as an outsider coming in, you have to first understand and do your research on the community that you're wanting to be a part of or be involved with. And be aware of others' perceptions of past engagement activities. So you may be coming in and you have a great idea, great passion, truly care about the people, but understand what the history currently exists. Have there been failed attempts at engagement activities before? Have there been times where researchers have come in and then because the funding ended, they just had to pull out and they weren't able to continue the work that they were doing? What does the community think about that? How do they feel about that? Those may be different barriers that you may have to work around in order to get what you're trying to get, but also that's going to be beneficial to the community. So you want to be knowledgeable about the community as much as you can, and that takes time. You want to build and maintain relationships and trust. So it's going to take time and it's going to take trust. You want to have trust with the community leaders. Who is in charge? Who are the stakeholders to the community? Who are the gatekeepers to the community? Who are the people when the decision is going to be made? Everyone believes in and everyone talks to Mama Joe. She is the person everyone goes to. So you know, if you don't talk to Mama Joe, you're not going to get any kind of buy-in from the rest of the community. Who are those key people? Those are the people you want to start off with, just building a relationship. And then not only build it, but maintain it. And the more you talk to the people and you show up and they learn more about what you're doing, what your interests are, then you get to formalize trust and build trust. And then there's also the importance of remembering and accepting that collective self-determination is the responsibility and the right of all people in the community. So no external entity should assume or feel like they can come in and give power back to the community. The community already has the power. They already have everything they need. It's more of helping to build their capacity. So we're helping them realize that all people are a part of the decision-making process. It's not the community, it's not the researchers coming in to change something or tell them something needs to be fixed, but we help them realize the power that they have. And then the fifth principle is to establish a partnership within the community. And that partnership can be around a specific goal. So whether that goal is to create a change and improve health, what is that specific goal that you're establishing a partnership for? You may work with the health department for one project. You may work with the government for a different goal, but make sure that it's clear what you're meeting about and then establishing that goal together. And then the sixth principle is recognizing and respecting the diversity within the community. There may be a variety of persons that are there. They may come from multiple backgrounds. Understanding those demographic trends is going to be helpful in recognizing that diversity that exists, and then identifying and mobilizing community assets and strengths. And so you do this through the community's capacity, through learning the community. You understand where are they strong, and some of those different outputs we talked about, whether it's a presentation or it's a video or it's a training or a workshop, those are things that might be a part of the research where it's helping to build capacity, help them to realize what resources they currently have, help them to realize what decisions need to be made or different actions that can be made. So you're definitely a part of that entire process, but you have to identify, and sometimes it's helping to mobilize those community assets, and that might be with the resources that you have available to you as the researcher. This is a good one, is recognizing that individuals and the institutions and us as researchers, we have to be able to release control and be flexible to the changing needs. So with different times of year, different times, different seasons, the needs of the community may change. And how do we respond to when a community says this is no longer a priority or this is important for us now? How do we make those changes? How do we go about and ensure that we are listening to our community members, to the partners, to the leaders, and ensuring that their voice is heard? This picture is one of the pictures from after the tornado. There was a lot that changed within community engagement, at least in our area. And so we were working on a project around COVID-19. And even though that was our main focus, we couldn't say, well, we're only here about COVID vaccines at this point, right? The needs were food, the needs were clothes, the needs were electricity. We had to be able to shift and be flexible and adapt to what the current needs were. Because when you're able to include the community and you're letting them realize that their voices matter, what they need is important. We don't only need stuff from them, they need stuff from us too. But how do we make sure that that's going back and forth? That relationship is reciprocal. So being able to release control and being flexible is key to community engagement. That also helps with sustainability long term and people understanding that they can now trust you. They feel empowered when speaking to you. They know when they speak to you that their voice is being heard. And so those are also things that are important. And then fostering community collaboration. By any way that you can bring the community together is important. It's not necessarily even as the researcher, you may have certain resources available, but that doesn't mean that you have all the resources. Understanding what the community has available in them already is going to help them come together to work together to help whatever the initiative is that you're working towards, that you're researching together. So fostering community collaboration is so key because it allows you the opportunity to help the community see what resources are available to them as well. Sometimes they may not be aware that this place actually has a resource center and this person does transportation and this person does meals, but when you are able to help them collaborate together, it helps build the capacity for the community and they are stronger themselves. And then last but definitely not least, demonstrate trustworthiness. Be trustworthy. It's fundamental to sustaining successful community engagement. Be someone they can trust. Be the person or the institution or the researcher that if they are having a community problem, they can come to you and they feel comfortable. They can be vulnerable with you. You want to be able to be that voice, even to the institution, to the university, or to help with like policy briefs and bring that expertise back to the community. But be someone who's trustworthy. Be someone that the community can feel comfortable coming to you and knowing that you're going to listen to them and you're going to take what they say seriously and you're going to bring it back and help them work through whatever it is they're going through. So I'll take a quick pause to see if there are any questions. I know that was pretty fast going through them. Are there any questions? All right. So with there being none, we're gonna go on to what are the different benefits for faculty, students, and communities. When it comes to community engagement, we want to see how does it, we know how it's going to benefit the community. We want it to be beneficial to us as the researchers, but how can it also benefit those who may be working with students? So for those who are faculty, it enhances research relevance. It increases your competitiveness for grants. So being able to actually say that you have community involved in your research, that's important because it shows that you've already made relationships with stakeholders. A lot of the different grants coming out now, they want to see that you already have partnerships. They don't want to see that you're looking to create partnerships. They want to see letters of support from people that you have already built relationships with. And so the process takes some time because you have to develop the trust where they're willing to write a letter for you to say, we support this research that this researcher is doing because we've developed a relationship with them. It expands your scholarly outputs. The more partners you have, the more community engagement, the more people that you have involved in your project. Those are different avenues by which you can increase your scholarly outputs. You have more voices being heard. You have more modes of dissemination because now it's not just a paper just because you're trying to get a publication, but now you have someone willing to go to a conference. You might be able to help fund a community member to be that voice at a conference, or you might be able to help with a paper or a white paper or a policy brief, something that's going to help increase you as a faculty member, and it helps build those long-term partnerships. Oh, thank you for that. A memorable grant I reviewed years ago, included a handwritten letter of support from a young person on cute letterhead. So just imagine, like, that stuck out in Dr. Bhuwani's mind because that's how memorable it was. Are your relationships memorable to the point that someone's willing to make sure you stand out and you stand apart from everybody else submitting an application? There's a plethora of people submitting applications, but how are you going to stand out? What is going to make you different? And the key thing is community engagement these days. Now, when it comes to your students, whether you teach students or you have a lab where you can work with students, it applies the classroom knowledge to real world issues. So you may have students who are interested in the topic. They may not be fully aware of all the things, but now they get a chance to actually apply what they're doing in class into real world issues. It helps develop their professional and interpersonal skills, and it strengthens their career readiness because some of you may be the ones helping to bring in the next round of researchers into the research world. And so this opportunity allows students to be able to get better and be prepared. And it creates opportunities for mentoring and networking with both faculty and community leaders. So the students also get an opportunity to grow in their ability to be a researcher, to be a scholar. And that's because of the work that the faculty member may be doing in getting these grants. I have two students currently, and I have a community, well, I don't. The department has a community engagement collaborative, and we have over 60 participants from the community in it. One of the things I have is a grad student who's here at Florida State who oversees the collaborative. So they're the ones I'm like, okay, I work with them. This is how you send out the emails. This is what we're going to talk about. This is how you communicate with them. This is how we have our quarterly meetings. But letting them be able to grow in their career readiness, because that allows them to now stand out when they go to their next level. So it also takes some things off of the plate of the faculty member when you do allow students to be a part of the work that you're doing, if you're able to write them into your grant. And so these students are able to use the skills they're learning, apply it to real time. They're able to work on stuff, and you're able to work on stuff. And that also then expands your scholarly outputs, because now you're not the only one coordinating all the emails, responding to everything, but you have another person that you can train and trust to be able to lead a different initiative. And then when you think about your communities, it's so beneficial because the process and outcome can strengthen the health of community members, and it can really build sustainable changes. At the end of the day, I'm pretty sure with everything we talked about when you guys shared what fields you're interested in, we want to see healthy communities. We want to see people in the different areas become healthy. We want them to sustain their health in the different areas, in their nutrition and pain management and maternal child health. Like, we want them to be able to sustain those changes. And the communities, they end up shaping research that reflects community priorities. Remember, the traditional research way is the university down, the researcher down. Whatever they want to research, that's what gets researched. But when we look at this community engaged scholarly approach, we are now shaping the voice of what's a priority to the community. And when the community is a part of something, when they're invested in it, then they're 9 times out of 10 more likely to actually go through with what they're invested in, as opposed to someone coming in and just telling them they're going to do something. So when the community is invested, they actually take it seriously. And then because they're taking it seriously, you might actually see long-term sustainable change. It helps to build their capacity, because now the community is like, okay, well, I didn't know this can be done. I can learn this. I can now take on this initiative. I can take on this portion. Some things that may have seemed difficult may not be as difficult as they once thought. So allowing them to be a part of it helps them to build their capacity, and it improves their overall health well-being. And the key thing is strengthening that trust in academic institutions. So there is a lot that goes on with research. We've seen a lot of different trust issues and mistrust issues throughout the years with researchers and communities. And that's why community engagement is such a key piece to the research now, because they want to make sure that the communities do actually believe in the academic institutions. They trust them. So when you do come out, or if you are bringing in someone new to be a part of a project, they can say, well, I trust Dr. Horne, so I'm gonna go. If they brought somebody in, I trust this person, because you are a trusted voice. Anything that will actually benefit the community, they will actually receive it. They might not have received it if it didn't come from a voice they trusted, if it's not from a face they trusted, if they don't know your true intentions. But if you've taken the time to talk with them, to sit with them, to show up with them at their events, and they see your face, whenever you say, this is something we're interested in doing, or what do you think about it, then you can truly get their voice. You can truly get their feedback. And now you have helped build the trust with the academic institutions, who ultimately, as the researchers, really want to see them get better. So now we're going to talk about 3 different models of engagement and what that looks like. So the first one is community-based participatory research. Has anyone heard of that? You can just do a thumbs up in the chat or anything if you've ever heard of CBPR. Okay, I see a few thumbs up. Yes. So CBPR, it's a collaborative approach where community members and the researchers are involved in all stages of the research process, from promoting to help promote social change and improve the health outcomes. They leverage community strengths and they foster mutual benefit. So within community-based participatory research, you are bringing your community members, your engagement, your collaborators, your stakeholders from the very beginning. They are there when you're thinking of the idea. So you're not only coming up with the idea for the grant or the proposed research project, they are a part of the process of figuring out what is important, what we want to research, how we want to research it. And of course, with support, you might have to like educate them on this is how this can work, this is how this intervention may work, this is how this clinical trial may work. Of course, with it being, mutually beneficial to both sides, but they're still a part of the decision making throughout the entire process when it comes to CBPR. Now, service learning and engaged teaching, these are experiential educational approaches that integrate more of community service with academic instruction. So the researcher is going out into the community and they may be doing a lot more service learning. So they're their boots on the ground. They may be visiting the homeless shelter. They may be visiting the food banks. They may be doing a lot of that service hands on the ground, boots on the ground. And they're also incorporating an aspect of teaching with it. So this is enhancing the student learning experience. They're making sure their students are being involved in this as well. It's increasing civic responsibility for your students so they have an opportunity to also learn about being involved in the community and making sure that's a part of their day-to-day and how they plan on living their careers. So you'll see that a lot I know a lot of undergraduate courses may see it, but depending on which field you're in, you'll see a lot of service learning where you have a class where you have to do community service. I know in the public health program they have it, social work program, you have those internships, but that's another way to increase community engagement, and that's by allowing students to practice even at an early age. And it's not only just students, but because most times the teachers that are teaching it are the ones that are involved in the research, they end up getting that part as well. So it's a great way to incorporate service learning as a model of engagement, because it also guarantees that these different community organizations may be receiving service throughout the year. If you have a course around service learning 3 times a year, at least 5 students may be signed up if this is an organization that needs support, additional support. Now hey, I'll have 3 students every semester who can come out. So if you build it into the system, it's a way where it allows continued engagement for the organization that may need it, if that's something you see is needed. And then, of course, we have our translational research with community impact. And that's a lot of understanding like how we're moving research findings to improve practice, to help improve like public health overall. It often involves, of course, community engagement, but it ensures that interventions are relevant and sustainable for different communities. And so a lot of what we do, especially within like CTSA, translational science, we're taking that information, we're moving it from the bench to the community. So what do we learn in the lab? What do we learn as we're doing the work? And then now back to the community. How are they receiving this information? How are they interpreting this information? What do we have to do because they may not be interpreting it the way we meant for it? So now we need to go back. But any results that we're finding, we're bringing it to a practical format for the community to see and to completely understand. And so now that we've talked about principles and different models, now we're going to talk about the fun part, building those different partnerships and how do we do that? And so when it comes to building partnerships, we have to identify and approach our community partners. But how do we know who they are? We have to know the community. We have to know its constituents and its capabilities. So back to understanding those different principles, it's knowing the community. If there's a specific community you're interested in, then you want to do your research in advance. Find out who those key stakeholders are and be okay with having conversations even if you don't know, and ask those questions to help you find out who they will be, right? So you may not know who they are up front. You may have a passionate interest in, let's say, someone said like HIV, but they don't know anyone who may be doing work in the field, where they can find people in the community because that's who their community would be. Then it's going to take you some work. Ask questions, learn the community, see who are the leading players, what websites. And then you start off by, we'll talk about like sending emails or making phone calls or showing up to events or conferences where you see your community will be present at. So know the community, know its constituents, and know its capabilities. Then you want to establish your positions and strategies that will guide your interactions with these partners. So, what is your position? It's articulating your core values. It's stating your organization's mission, vision, and values to guide the interaction. So, you first, before you can even approach them, you must know what are your values. How are you going to, or clearly state what they are so that when you do approach these community partners, you're able to say what you do, why you do, and how you do it. And then you have to understand your strategies. So identify 3 to 5 areas that your organization will focus on. What are some things that you're focusing on for the research? What are your plans? So when it says clearly identify those as a principle of community engagement, know what it is you want before you go to the community partners, because you want to know and make sure that you are communicating with the right community partner. So if you don't share what you're looking for, what you're in need of, you may not be directed to the right person that can actually assist you or help you, or you may not get into the right community that you need to be a part of for the research that you're interested in. So you want to establish your positions. You want to know what those different strategies are that you have in place. And then you want to think about how your messaging is going to be. So you want to go from just responding to events and saying, okay, this event's going on, I'm going to show up, and say, okay, well, please reach out to me if you're interested in partnering. I'd be interested in talking to you. You want to be proactive. You get the names, you get the email addresses, you get the phone numbers of those that you're interested in. You send out the initial email. You try to schedule a coffee chat or a tea time if you don't drink coffee. You try to set up a lunch, but instead of waiting for people to reach out to you, it's okay with being proactive and reaching out to those, because they may not know that you're there, or they may not know how to reach out to you. Even if you provide it, you're the one that's in need of something as well. You take the initiative, be proactive, and reach out to others, especially different community partners that you're interested in. And then those different strategies, you want to create a plan. We're going to go through like 2 different plans. Create an outreach plan of how you're going to reach out to your community members that you're interested in participating with. Think about the different ways that you're communicating. Are you doing everything via email? Do you realize you're not getting that many responses via email? Maybe you want to set up a time that you do a phone tree. Maybe it's the time of day. Maybe your community partners are not available during the 8 to 5 time or the 9 to 5 time. You might have to set up like a Thursday afternoon from 5 to 8 where you can call community partners who may be available. So switch up how you're trying to communicate to community members too. Find out what works for them, because what works for you in our academic setting may not be the best time for your community partners. And then you want to have a follow-up plan. You want to find a time to listen, allow them to give you feedback, ask them their questions, ask them how they feel about what you may have been presenting to them. Don't just go and say, okay, I know I'm here to make partnerships. I'm here to learn from you. I want to just tell you what I'm interested in. If you're not interested, okay, and then that's it. But then follow up. If you realize nobody's interested in doing what you're interested in, or you're not getting any feedback, what can you do differently? What approach can you do differently? How are you going to guide those different interactions now that you've made contact? You want to have a follow-up plan. Maybe you have a spreadsheet and says, this is the day I sent the initial email on January 20th. And then in the email, you say, respond by a certain time. And then you do a follow-up 2 weeks later. If you check to see if you got an email back, then you schedule your meeting. But you do want to have some kind of plan for your communication and your outreach and community engagement. You don't want to just leave it blank and then hope that somebody responds. Be intentional. And as you are intentional and you show up and want to be intentional, then others are going to realize how serious you are. And they're like, you know what? I'm actually going to email them back. They did email me already. Let me get them back on the phone, right? So try to identify those partners and your different approaches to engaging with those partners. And then you want to establish trust and shared goals. So you want it community centered and community led. Ideally, you want your community being the ones that's leading the charge. You want them to be the one that's creating or co-creating the messages. And so when you allow their voices to be heard, then you allow other community members to be able to hear their voices, and they are able to realize that they are important. They are part of the process. So this is from a community meeting where you have the community members. You may have the whiteboards up. You may be taking down notes from what everyone's saying, but you're letting them realize that they're important. Their voices are important. You let them create the mission. You let them create the vision. You help them create the goals. Even though you may have some already designed, you can even share what you have designed and just ask their feedback. But you let them be a part of that process. That's also going to help when you're trying to establish trust and have those shared goals. And then you ask them what may be missing. What gaps do you see? What are we not covering? Getting their voice is key, and then actually implementing what they are mentioning when you have those conversations. And the last way is navigating those power dynamics and reciprocity. So some things that can be helpful are having sample MOUs or agreement templates. You want This is something that I know we do with our department. I have like a tracker of our MOUs. All of our community partners may be a part of the collaborative, but then we still reach back out and say, hey, would you like to further your commitment through signing an MOU that's already gone through legal with the university? Those are things you want to make sure they have. And even if the organization you're reaching out to has one, you want to make sure you still run it through legal. Say, hey, is there anything else? We had another community partner that reached out to us, and when we sent it to legal, they added an entire addendum just for our coverage. So you want to make sure that if you are going to develop something like that, you do run it through the legal department. But you want to have something, a sample. Ours is like a really one pager. It says the benefits is that we're available to you. You can be invited to any of the research. And then any resources that we have are available, vice versa, however you may need it. It's a very simple MOU that doesn't look like it's requiring much, but allows for flexibility, and it allows to be able to move and to be flexible based off of whatever needs may change within the community. And then you want to bring your partners to the table before a grant is submitted. So if at all possible, you want to bring them to the table, even if it's one person, even if you create a community advisory board of 2 to 3, 3 to 5, 5 to 7 people that works for your research. You want to try to bring them to the table early because of those things that we talked about, having your letter of support. You want to have more than one letter of support. So bring them early enough, even if it's asking what the research question may be. Maybe you had 10, maybe it goes down to like 5. Actually, maybe it should just be 1 or 2, right? And so once you get that, maybe one is one question that you, the researcher, have, but this is also another question that's important to the community. You didn't realize, oh, we can actually do that. Like, that's another way that you're bringing their voices into it. So we want to be mindful of those different power dynamics and how we're communicating with our community partners and making sure they're a part of the process. Because once they're invested and they see themselves, they're going to make sure that this project goes to fruition. So bring them to the table early if you can. Have sample MOUs, but it's not a requirement. You can still work with community partners even if you do not have an MOU. So don't feel like pressure to have one right away, because that comes with time, that comes with trust, that comes with after you've built a relationship over years. And you may have some that you've worked with for years and you never thought about developing an MOU. Go ahead, get one. It can be simple enough where you're able to shore up that relationship, make it a little firm, where everybody understands like, okay, so I know this is a trusted partner. If I reach out to them, even if I'm in a time crunch for a letter of support, we've already built this relationship for a year. They wouldn't mind doing a letter of support for me. So let's talk about sharing and sustaining this engagement before we go into our activity. So dissemination strategies, we want them to include your community voices. I alluded to it earlier, but you want to consider audio or visual dissemination. Maybe the results of your study is a video, maybe it's a dance, maybe it's a play, maybe it's writing a book together, like a community book. You want to consider other alternative methods outside of the traditional methods, especially if it's just like a paper or article. You want something that's not hidden behind a paywall where your community members don't have access. We may have access to lots of different journals because of, our connections, our jobs. If that's the only place you're putting your results for community engagement research together and your community has no access to it, that doesn't make it more likely for your community partners to want to continue to partner with you. They see that you came into the community, we've worked with you, and now they don't even have access to the results. So what are some other methods of getting those results out? You want to be readily available resources for the engaged community. So what is something that they can take? Maybe it's a one pager. Maybe it is developing a training. Maybe it is developing a workshop that can be done once a year, once every 6 months, but you want something that includes your community voices. And even if it's where you're able to take like your main stakeholder to a conference or something where the community is now speaking in these academic settings. Hearing from community voices really makes a difference, especially when this strategy that you're using has definitely made their and centered their voices. For others wanting to do more of community engagement, they're going to love to be in a session where they hear from the community member about how they worked with this academic institution, how they were able to build trust with them. Going to conferences and hearing those presentations are so much, they're worth it so much more because you're like, wow, like you guys got it. You guys were able to actually bring it together where we're actually seeing how this symbiotic relationship works, right? And you want to actually consider sustaining the relationships beyond the project. So while you're developing this grant, this initiative, this research, and this is why it's important to try to get your community partners before you submit your submission, before the grant submission, because when you include what sustainability looks like and you already have the community buy-in, even if the funding ends, that might be a way for them to try to find a way to get additional funding or additional resources for the community. So getting their buy-in early helps to sustain a project beyond a project date. Let's say the grant ended on December 31st, 2025. The funding may be done, but we've established this every 3 months we meet at this time. So even if there's no funding associated with it, now we are invested in the results. We are invested in this end goal to help with the overall community health. We'll find a way. They may be able to find things through the city, through the county, through their government, through different foundations that can help continue to sustain something. But you will have to have had their buy-in from the beginning, and ensure that it's a part of the sustainability of the project beyond the deadline. So incorporating your community in that process is key to sustaining those relationships. So we're going to look at two different quick plans. And so I don't know if you want to take a few minutes. I can give you a few minutes to work on this or see if there's any questions real quickly before we look at these tools.
So, Dr. Horne, I do have a question.
Yes.
Early on, there was quite a bit of conversation or mention of building trust.
Mhm.
What are mechanisms to build trust? So it's one thing when I say, hey, you need to build trust with the community. Like, how do you build trust?
It's a great question. And so building trust is not a one-way street. It's not only one way to do it. There are multiple ways to building trust. I would say the first thing when it comes to building trust is one, knowing your community enough to know who you want to build trust with. Because you want to know who are those stakeholders, who are those key holders, who are the gatekeepers, but then also being genuine and authentic in your conversation about why you're trying to build trust. If you go in and you're telling them, hi, I'm Dr. Horne. I'm a new researcher here at Florida State. I'm interested in getting more involved in the community. I really am passionate about these particular areas of interest. Do you have any ask for suggestions? Be humble enough to be vulnerable enough to ask for help. Say, I'm new here. I'm interested in this, or I'm new to this topic and I'm interested. What are some things going on in the community? An easy way to just learn about community events that are going on, to get your face seen and such as if that's the way to say it, like just be visible and listen. Just show up and be listened. You can go on Eventbrite. I know that's very non-traditional, but look for events around the topics you're interested in. Check to see if there's like a community health fair going on, or if whatever the topic is, if there's a workshop going on. And sometimes just go and just listen. Is there a community town hall meeting? Show up to the town hall. Listen to what the community members are saying. Are issues? Are there different health boards across the county, across the city? I know the Big Bend has one. Leon County has one. Gaston County has one. They have like health councils, and those meetings are public. And you can just show up to the meeting and just start letting your face be known. And then even if it's Like if you have a resource to offer because this is something you're interested in, raise your hand. Hi, I'm so and so with FSU. Or hi, I'm so and so. I have an interest in this. I have these resources. You can find more information about this here. So just showing up is the beginning of building that trust. Now, once you've shown up, now you have work to do. You have to stand behind what you say once you show up. Have your business cards available. Connect with those people that you see are leading. Look for who those key people are, and then say, "Hey, I noticed you were talking a lot about this, or you mentioned you were with this organization. I'm Ericka. I'm Dr. Horne with FSU. Do you mind if we catch up? Can we meet for lunch? Can we do coffee? Can we do tea one day? How can we start building that relationship?" So then, after you've shown up, if it's something you're new to and people have seen your face, then you reach out directly to those people and say, "Can we meet?" And just ask questions and just sit and listen. Mostly, probably barely talk about yourself other than what you're interested in, of course, like research wise, but just sit and listen. Like, what have you noticed? What have been main struggles or barriers in the community? I see you're one of the leaders. Everybody looks up to you. What do people have problems with? What are they complaining about? They need transportation. Okay. They need this. Okay. We need more this. Okay. And just listen to what the community needs are. Because then when you finally listen to everything, then you say, well, I may not have a solution to all of this, but this is what I work in. Is there any of this that's related to it? Talk together about how your plan or your works may fit into what the community needs are as well. So yes, we're there. We're trying to get research done. We want to get done. But also, I think it's also key to understand that trust has no time limit. We can't rush the process of developing trust with our community partners. I know sometimes we have deadlines with grants and deadlines to do things, but if you're really trying to build real trust, then you can't put a timeline on building trust because it's all dependent on the community. And if you've done the research to see what the history is, and maybe meeting with that community member is where you ask those questions. What kind of history have you guys had with researchers? What kind of history have you guys had with projects that started and ended? How do people feel about these different things? So I think those are all key points to developing that trust. Like, how do you actually do it? Sit down, talk to somebody, listen, and don't try to put a time limit on it. That's gonna be, I know, and I know with grant deadlines, there's specific deadlines to do things, but that's why it's important to start developing the trust even before the submission's needed, even before you know what project you're doing. You can have an inkling, definitely have an idea of what you want to do, but once you've talked to community members, then that might help shift what you're doing. That way it can benefit both of you. So it's actually mutually beneficial for both. I hope I answered the question. Okay.
Great, thank you.
You're welcome. Any other questions? All right. So this first plan it's basically a one-page community engagement template. I can actually send it's in a page, a worksheet form. But what you would do is on it, there are these 6 boxes, and you would fill in the question to these 6 boxes. So I can give you guys a few minutes to do that right now. I'm gonna give you guys like maybe 3 to 4 minutes. First question, in your community or population of focus, who needs to be at the table for your research to be relevant? And take the time to just sit and think about it. Who needs to be relevant? Who needs to be at your table? You would sit down with yourself and answer these questions. Providers, it's good. And realize this question is important because our community is not always going to be the same. Even though we say community engagement, if I'm working with providers, then they need to be at the table. If I'm working with the elderly, then they may need to be at the table. If my community is I'm doing research on researchers, then they need to be at the table. So your community varies based off of who and what your project is about. So don't limit your mindset. I know I talked about community examples like in like the actual community because that's where I work, but don't limit community engagement only to those spaces. It's whoever's relevant to your study or your population of interest of the interest areas we talked about in the beginning and you put in the chat. What are those population of interest? That's who needs to be at your table. The next question is, why do you want to partner with the community? What value do you hope it creates for them and for you? So before you even reach out, why do you want to partner with them? and you're already looking at that relationship. How can I help them? How can they help me? How can we make this a symbiotic relationship? Make it reciprocal. How are we both benefiting from it? Not just my side, not just their side, but how do we both benefit? And once you figure that out, that's when you can put 2 to 3 strategies, and you can probably come up with some more strategies that work, but 2 to 3 of these engagement methods and strategies to help you figure out how you're going to engage them. Whether you decide to do listening sessions, you can create a community advisory board. You can co-design sessions. So if there is that key community member, you're asking them, how do we do this? You're letting them together. You guys together are creating the session of what you're going to do. You could do town halls where you invite everybody in the community that you're talking about and have them all come. You want to hear from everybody at one time. You can have partner-led recruitment where your community partner is leading the recruitment efforts. They're the ones that are reaching out. If you're partnering with a healthcare facility, maybe they're the ones that are they're the ones that are recruiting participants for the study. You may not have to be the face of recruitment. And then talk about the community dissemination techniques. What's going to be important? Do you need to have community dissemination, whether it's videos, whether it's town halls, whether it's those different circle sessions, focus groups? What are those different engagement methods that work best for your community and what you hope to gain? Because now you're doing it based off of the first 2 questions and not just what you think works for you. Because this is what you're used to. You may be like, I always do focus groups. I'm going to do focus groups. But then when you look at your research and you look at who's a part of it and you look at what's going to be beneficial, you're like, actually, I might not do focus groups this time for this project. That doesn't mean that it's bad, but you want to pick what works best to streamline your process as well. And then your power sharing strategy. What decisions will the community have a say in? Are they going to help create the actual design? Are they going to help create the evaluation questions? Are they going to be a part of that process? Are they going to be a part of developing the questions for the research? Where do you want your community's voice at? And then you want to look at the trust building actions. What behaviors will show credibility and reliability? What behaviors from you will show your credibility? Like you know all this, you know exactly what you want done, and your reliability. How are they gonna know that you're reliable? Have you already shown up? Do they already have a food drive once a week? Or do they have a food drive once a month and you go every single month? Or you say, I'm gonna come every other month. So they're like, oh, okay, you are actually showing up. I can trust this person. They're reliable. If I have a concern, I know when to bring it because I know when I'm going to see them. How reliable are you? And then lastly, benefits for the community, because at the end, it is still about the community being whole. Even the idea of we want to reduce obesity in Gaston County. We want to make sure that they show up from that initial example. What tangible or intangible benefits can you offer? They didn't understand why I wanted to do obesity. I wanted to have this entire program around obesity for youth. But they're like, we didn't look at the sidewalks. We didn't look at there's no safe green spaces. We didn't look at there's no lights. So what tangible and intangible benefits can you offer? Maybe we can provide trainers. Maybe we can work with someone with Department of Transportation. Maybe we can connect you to a city manager. Maybe we can do something tangible or intangible. Maybe we actually come out and provide basketballs. Maybe we provide soccer balls. Like, what benefit is it to the community? So this is the first tool that's really helpful if you're starting from scratch, you're at the beginning of the process and you're trying to say, okay, I know I want community engagement a part of my research. Where can I start? This is a good way that you can start and just say, you know what, let me go and get everything out of there. Let me just go get it all. And then the second one is called mapping your partnerships. And so when you're doing your mapping your partnerships, the first thing you want to do is identify people, groups, or institutions that you can build a relationship with. So this is like if you had a fresh piece of paper, just list out all the people that you can have a relationship around your topic. And then the second thing after you've made your list is to actually map it out. In the middle, you put your research project. And then you organize all your partners to see where they fit. You may not have a partner in every single circle, but categorize your partners where they fit. Who are your community partners? Who are those with the different local organizations? Who are your stakeholders with lived experience? I want them a part of my project. You may not need them depending on your topic area, but who are the advocates? Who are the navigators? Who are going to be the ones to help with pushing forward health and healing? Who are your community cultural leaders? Who are the ones that everybody goes to for advice? And who are your natural connectors? Who are the people that naturally just everyone knows? You're like, they may not know my topic, but everyone knows them. So I need them on my list of connectors. I need them on my list of people that are part of my research project. Because even though it's not specific to them, they are connected to the community. They're like a community gold mine. So I need them, right? And then once you've mapped out and put them on your board, you decide which partners are essential now, which ones should be involved before submitting the grant, and then you look for where you have gaps within your community. So this is the second tool. You can map your partnerships. And you can do them, you can only do one. You don't have to do both of them. Sometimes you already have a lot of partners. You just need to know where they fit in for the specific project you're working on. Maybe that's where you start here, where you just map out your partners, list all your partners out, see who fits for this project, and then see who you need to get to the table now because the grant is due in 2 months versus who you can reach out to once you've received it. You're like, okay, now we need to set up the specific sites and times for this. And then while you're thinking of that, you can say, who are we missing? And ask your partners who you're missing. A part of it is you don't have to know all the answers yourself. You cannot know. So you can definitely ask your community partners, hey, who's missing? I think at the end of all of our meetings, we ask, who's not at the table? Who have we not brought to this table yet? Who needs to be a part of our conversations? And so asking your community partners also expands your reach for other community partners that they may have and other stakeholders who may be beneficial to your research project and for promoting this holistic wellness for all people within the community. And so with that, I leave it open if there are any questions and hand it over to Dr. Budwani.
Oh my goodness, this was Dr. Horne, you did a fantastic job. I was actually Dr. Nar sends her regrets. She was actually double booked in this time slot. I just have so many questions about, how does one identify which partner, is the ideal partner? Let's say you're starting new. We've got our K-12 scholars on this call and our CTSA scholars, and they're emerging, right? And they may be working in, secondary analysis or genetic linkages. They may be working in aphasia. How do they find who the partner is? How do they vet them?
That's a great question. So, if you're looking, you're trying to figure out how do I even find people, one thing you can do that has been helpful is reach out to your local community here, like even at FSU. If there are anybody who does a lot of research or does stuff in community engagement, I would say try to link up with those persons. Like even myself, like I know we have a collaborative ourselves, and we are always sharing what FSU partners tell us. Like if someone's on campus or someone's here in the university, and they're like, we have this project going on. We don't really know where to start. We'll invite you to a meeting. You can share, even if it's like 3 to 4 minutes about what's going on, and people are really able to connect with you. I would say anybody who's in the field of community engagement, reach out to those people, whether it's different institutions on campus, if there's different institutes on campus. But then even, I know it seems really taboo, but a quick Google search will be helpful. You can just say like, who works in this field and maybe use the layman's term as opposed to like our scientific terms. You're doing something around thirst, you're doing something around like different symptoms of something. You can look up organizations around this and start really simple. Like you don't have to make it harder than it really is. Like start with finding those who are doing community engagement work, see if they're connected to any boards, any community advisory boards, and just asking, hey, who would you recommend? And so I may say, oh, we have people that work in that are in food security. We have people with environmental justice. We have people in these areas. Oh, we know some of the physicians that do research in this area. I know an allergist who does this. I know ENT who specializes in this. And even if they may not be the person, what you're doing is now expanding your circle. What you're doing is now allowing other people to know what you're looking for, what you're interested in, and then they can still connect you to more people. And so it's really just getting connected to the right folks. You may not find the right person the first time, but just opening your possibilities and being okay to ask a question.
Thank you, Dr. Horn. So just wanted to point out to everyone, part of, the work we do is evaluation. And Andrea has graciously shared the evaluation link in the chat. Please click through, and we really do want your feedback. What do you want? What did you like? What do you dislike? How can we make this better? Dr. Horn, you're amazing. And so super excited. We have a request for you to share your deck. I hope that's okay.
Yeah, that's fine. I'll send it over.
Awesome. If you want to convert it to PDF, or we can do that when
Okay.
we receive it, and then Andrea can send the PDF out to attendees.
Okay.
Only it looks like
Dr.
Crystal Ladwig
Ladwig.
has her hand up.
Yeah.
So,
Hey everybody. Dr. Horn, first, thank you so much. This has been fantastic today. I'm actually presenting on a topic later this week for CCI and some of these similar topics, so you're just added to my slide deck. Thank you.
Awesome.
Thank you for that. I just actually wanted to piggyback on something you were just saying about finding collaborators, and just let make sure the faculty are aware that are on here are aware that when you're looking for a collaborator, definitely use all those existing networks that you were talking about. But also, especially if you're looking for somebody internal within FSU to collaborate with, please feel free to reach out to our office. That's one of the things that research development can help with. And you may not have that connection, but we may. So we want to help be that matchmaker where we can. So I just wanted to throw that out there for everybody that, please feel free to add us to that list of resources that you have to help find those partners. And thank you again, Dr. Horn.
No, thank you. Thank you for sharing that. See, already a resource already shared, just like that. That's exactly how it happens, you guys. You just have to ask and you will receive. Any other questions? Oh, and so,
on that note, I think we can wrap this series of one of two.
yes,
I cannot express my appreciation so much. Dr. Horn, you did a fabulous job in terms of laying the foundation for all of us to learn about, the scientific basis of community engagement, right?
absolutely.
Would you be open if people have questions between now and the second session, if they reach out via email, would you be open to responding?
Yes, feel free to reach out to me via email. With that, I'll piggyback. Our next session is next week. We are bringing in 4 of our community partners to be a part of the panel. And so if you have any specific questions, we have someone that's in consulting, someone that does environmental and food security, someone that's in Fort Braden in the resource center. And so we have quite a few different varied backgrounds that are coming that are just looking forward to sharing with you or even about the work they do. But you never know, you might find a connection there, and they might or will likely have some kind of answers to that you may have about the different research you're interested in or looking forward to doing.
Brilliant. Thank you so much. I look forward to seeing everyone back online next week, and this panel is going to be amazing.
Yes.
Again, please go ahead and complete the evaluation. I hope everyone has a great rest of the week. So, bye all.